But those are the different licensures that exist. And then on top of that, there's different modes of therapy, which I'm not going to get too into because there's so much that go into it. But there's cognitive behavioral therapy, which is called CBT, which is probably the most used mode of therapy. All of the therapy methods that are used are evidence based. They've been proven by science that they do work. It's not, we're not just educated in this, like, I'll just talk to you and things are going to get better. There's scientific methods that have been proven that work for people. A newer method of therapy, which I do not provide, but I really like, and I've researched on it, is called EMDR. And that is specifically for people that have dealt with trauma. And it's highly successful also with veterans that have struggled with trauma during war, but it can be used for any sort of trauma. The reason I like EMDR so much is it's different than traditional talk therapy. So if somebody's struggling with trauma, could be anything, and it's very difficult for you to talk about it. It's something that every time I talk about it, I get a negative reaction, and I can't get through it without crying, or I can't even say the words out loud. It's very distressing. EMDR doesn't even require you as the client to talk about your trauma. So you can meet with a special EMDR therapist that has the training in it, and they just tell you to think about your trauma. And then they walk you through with their steps and their knowledge and their education of how to process it without even talking about it. And it's proven that it changes the pathways in your brain to helping you overcome and start to heal from these traumatic events.